On this week's episode, Dr. Rob shows us 3 ways to rehab your shoulder pain.
Hi, I'm Dr. Rob Calcaterra with the Springfield Wellness Center, and today we're going to cover shoulder injuries. A lot of people come in with shoulder injuries either from like old sports injuries, if they've had surgeries that just didn't necessarily heal correctly, things like that. And a lot of times what we really have to focus on is just loosening a lot of tight muscles in the area. Today what we're going to be looking at is different things we can do in the office, like muscle stretching. We can use laser with it, but there's also some at-home exercises that Rainey's going to cover, and some foam rolling and lacrosse ball that we can do at home. So using a foam roll and lacrosse ball can be really beneficial in loosening a lot of these tight muscles, and this is stuff you can do at home. We're going to start, if a lot of these things are too tender, maybe start with a tennis ball. It's not going to dig in as hard, but eventually you'd want to progress to more of a like lacrosse ball or something like that. You can take this, put it right against your shoulder blade, lean back against the wall, and you can just kind of roll around on the shoulder blade, really focusing on anywhere you feel really tight spots. So say right there is really tight, I can just kind of take and dig into that area. You can also take to kind of start getting some muscles under the shoulder blade. You can take the arm up, stick right to the side of the shoulder blade, and you can kind of roll those back and forth. And these might be pretty tender at first, so be a little careful. You don't want to dig too deep on this one. If either of these are too uncomfortable, you can't really use the ball, you could start with a foam roll instead. And I would usually have people, for the inside, they can just lay on the foam roller and just kind of roll along here. And again, I'm just kind of rolling right along the inside of the shoulder blade here. Or you could even, to really get the back of the shoulder blade, kind of just roll the arm over and you can just roll on it just like this. So today we're going to go over the laser, and with the laser it's really beneficial for any sort of soft tissue injuries, any strain sprains, things like that. We have several different heads that we can use, really depending on what kind of tissue we're working on. So this is one of the smaller contact heads. With the contact heads, you can get into smaller areas and you can kind of dig along, break up some of that scar tissue in the muscle, and it allows you to penetrate a little bit deeper. For something like a shoulder injury, we would probably use the small contact head so that we can get into those small spots easier. Now we also have a large contact head, which you can use for bigger muscle groups like the spine, the neck, legs, things like that. We also will have non-contact heads that in sometimes areas are a little too sore to have any pressure on, so we would use a non-contact head at that point. Try to get rid of some of the swelling and bruising in the area, then we can dig more into it with the contact heads. Now we have a large contact head, so for a big area, like say somebody just sprained their knee, but it's too sore for us to work on, we would want to use something like this. So in terms of muscle work for the shoulder, this is the most common areas we usually have to work on. It's usually back of the shoulder here. What I'm going to have her do is she's going to take her arm here, bring her arm forward, and turn down as you go forward. So we're just going to do this kind of back and forth. I'm going to push in, but let me know if it gets to be too much, if it's painful or anything like that. Can you feel a stretch doing that? Mm-hmm. Okay. There we go. So most of the time, once you get a lot of this stuff loosened up, the shoulder blade can come down and back more. It can be in a better, more stable position, and a lot of movements are a lot less painful.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week we're talking about shoulder pain. So I'm going to go over 4 different exercises you can do at home to help strengthen the muscles in your rotator cuff. So if you're having any kind of pain moving your arm in and out or up and down, these would be good to try at least to see if you can strengthen those muscles and then hopefully relieve that pain. So what I'm gonna do is use a resistance band for all of these exercises. We have these bands in the office that have handles, which work perfectly for this. And what I've done is I've like anchored it to this pole here. If you don't have something you can anchor it to like this, you could shut it in a door and make sure that it's plenty secure when the door is shut. You could do it that way, I guess, too. But, so what we're gonna do is we're gonna do an internal and an external rotation first. So you're gonna face one way with the band coming at your side, holding it with one arm. So I'm gonna start with my right arm, and keep your elbow locked kind of by your side and bent like this. You want the resistance band pretty tight. You don't want it kind of like loose and flopping around like that because you're not gonna get as much out of it. So keep it nice and tight, and I'm gonna move my hand away from my body, only rotating with my shoulder. So my elbow is still locked by my side and bent like this, and I'm feeling it in these muscles up in my shoulder out here. So you'd wanna do about 10 reps of those, and then stay facing the same direction and just switch arms. This time, because I moved it back, it became pretty loose again, so I'm gonna need to take another step out. Keep my elbow locked at my side again, and this time I'm pulling it across my body. So now I'm doing internal rotation, but I'm still rotating through my shoulder, and I'm feeling it in these muscles up here. So again, you wanna do about 10 reps of these. Then you will need to actually turn around so that you're doing the internal and the external on the opposite arm. So when I was facing this way, I was doing external with my right arm, but when I face this way, I'm gonna do internal with my right arm. So just make sure you're doing it facing both directions. The next one I'm gonna show you is just a pull down. So again, if you can anchor it to something, just make sure it's anchored up high. If it's shut in a door, just shut it in the door up at the top. But you want to have it as high as you can get it. You're gonna step back until your arm is like level, parallel with the ground, so it's just straight out like this. The band is pretty tight, and then all you're gonna do is press the band down by your side like that, and you're gonna do 10 reps of those. So this one too, I'm feeling this along the back side of my shoulder and those muscles there. You wanna control the band the whole time. You don't wanna just like control it on the way down and then let the band pull your arm up like this. You wanna make sure you're controlling it down, but you're also controlling it up, just so you're getting the most out of it. Then of course, you need to switch to the other arm and do it on that side as well. Just make sure too that your hand, or you're gripping the handle with your palm facing down, like that. All right, and then the last one is just a shoulder raise. So this time I'm gonna move the band down towards the ground. So you want it to be as low as you can get it. So if you're anchoring in a door, just make sure it's down low, but it's not gonna slip from under the door. And this time I'm gonna face away from the band. So I'm facing this way. My grip is over the handle still this way, so my palms are facing back. And it's right next to my side. The band is pretty tight. This time I'm gonna raise it up. This one tends to be one of the hardest ones, especially if you're having shoulder pain. So what I want you to make sure that you're doing is you're only getting to about this high. We don't really need to go way up here because then the band kind of like flies out of control. So you just want to get it to about parallel with the floor and down like that. Again, control it slowly. Even if maybe it's causing pain to get it that high, because this is a harder one, even if you're only getting it, you know, like 45 degrees or whatever, you're still doing work. I'm still feeling that in my shoulder. You're still doing work with those muscles. You just will have to work up to getting it a little higher. Then of course, you need to switch hands and do it on the opposite side as well. So you want to still do about 10 on each side. For all of these, I would recommend doing a couple sets. Obviously, the more you do, the better, but don't overdo it, especially if you're in pain. So hopefully those 4 exercises will help you with your shoulder pain. And that's this week's Fitbit, and we'll see you next time.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.